Since taking office in 2009, President Obama has ensured that no American will be denied health care coverage or charged more due to pre-existing conditions as of 2014. The health care reform, also known as the Affordable Care Act, that was put into law on March 23, 2010, is not only a benefit to our country, but to our citizens as well, by ensuring security they deserve and protecting Americans from insurance abuse. The Affordable Care Act allows all Americans to make health care decisions that work for them, guaranteeing access to care and will bring down costs and improve the care quality. I plan on going into the healthcare field and will be personally and professionally affected by the Affordable Care Act. With this new act, many begin to wonder, what is it? How will customers be protected and what are their rights? Is it truly more affordable coverage? Do customers really gain access to better care? And does it really strengthen Medicare? Many Americans do not understand the meaning of what the Affordable Care Act truly is. The Affordable Care Act, also known as Obamacare, represents the most significant government expansion and regulation since the passing of Medicare and Medicaid in 1965. It is aimed to decrease the number of Americans that cannot afford personal health care by including mandates, subsidies, and tax credits. The Act also provides security when it comes to insurance companies to cover all customers and or applicants. It is also there to regulate the same rates regardless of pre-existing conditions or sex. Customer rights and protections also play a huge role in the Affordable Care Act. In the past, insurance companies have taken advantage of customers and could deny anyone with any pre-existing problems. The Affordable Care Act creates a new Patient's Bill of Rights that helps to protect the patient. The patient now has the right to be covered by insurance agencies even if they do have pre-existing diseases such as diabetes, asthma, or any other condition. Putting a peace of mind at more than 17.6 million parents with children of pre-existing diseases. Also, there is a limitless care, so patients will not run out of their dollar value of their insurance companies, so they will no longer result in lifetime dollar limits to care. Along with limitless care, insurance companies can no longer drop your coverage when you become sick due to a mistake on your application. Patients' rights also result in a more affordable coverage in the healthcare setting. The Affordable Care Act also promotes in bringing down healthcare costs so you can spend your money more wisely. The new law will help with lowering costs through tax credits and new marketplaces where insurance companies have to compete for your business. Thanks to the Affordable Care Act, a new 80-20 rule is put into play. Insurance companies will be responsible for 80% of the premium while the patient only pays 20%. If the company decides not to pay 80%, then they must provide a rebate to the patient. Also, small businesses that want to offer health insurance but cannot afford it will be offered a tax credit that will benefit more than 2 million workers from an estimated 360,000 small businesses. More affordable coverage will ultimately lead to a better access of care in the United States. Having a better access to care builds and strengthens our healthcare system. Insurance companies are required to provide better services such as cancer, diabetes, and blood pressure screenings without additional copays and deductibles. Under the new existing law, children can remain under their parents' insurance coverage until the age of 26. Also, more than 50,000 Americans have already gained a pre-existing coverage plan thanks to the Affordable Care Act. Along with having better access to care, it helps with strengthening Medicare. Over 50 million older and disabled Americans depend upon Medicare each year. By adding new benefits, fighting fraud, and improving patient care with the Affordable Care Act helps in promoting a stronger Medicare. Previously, 1 out of every 4 seniors went without a prescription due to the high cost because they just simply couldn't afford it. With this act, they will receive discounts and additional savings by the year of 2020 on name brand and generic drugs. Senior citizens will also benefit under law by receiving free flu shots, diabetic screenings, and as well as annual fitness visits. So far, more than 32.5 million seniors have already received one or more of the services I just said. The healthcare law also helps with stopping fraud by providing tougher screening procedures, tougher penalties, and new technology. Strengthening Medicare along with the previous points are great examples of why the Affordable Care Act is a benefit to our country. The Affordable Care Act allows all Americans to make healthcare decisions that work for them, guaranteeing access to care, and will bring down the cost and improve the care quality. With it, some still may wonder, what is the Affordable Care Act? How will customers be protected and what are their rights? Is it truly more affordable coverage? Do customers really gain better access to care? And does it really strengthen Medicare? Since taking the office in 2009, President Obama has ensured that no American will be denied health care or charged more due to pre-existing conditions in 2014. The health care reform, also known as the Affordable Care Act, that was put into law on March 23, 2010, is not only a benefit to our country, but to our citizens as well, ensuring security they deserve and by protecting the Americans from insurance fraud.